All right, I think we're ready to go.
Got it. All right. Well, welcome everybody. It's wonderful to see so many of you joining us around this HUD grant opportunity. It's an exciting time in the state, and we're hopeful that some of you will choose to pursue this opportunity either this year or maybe consider it for next, based on what you learn here. But we're excited to share this with you, and thank you for joining us. Just a little bit of background on the National Green and Healthy Homes Initiative, and we'll go ahead and introduce ourselves. My name is Bert Cooper, and I'm the Vice President for State and Local Strategic Services for the Green and Healthy Homes Initiative, and have the privilege of working on healthy housing, green and healthy housing, if you will, initiative issues around the country. And I'm joined by Catherine Lee, who is our one of our gurus here and technical assistance providers, and one of our directors on the initiative, who's also working around the country on us. And I will say New Jersey is a very special place for us, given everything that you have going on there, in terms of your new rental law and water issues and a number of other issues around lead and healthy housing. But a little bit about the background of our organization. Our vision is to advance the social determinants of health and racial equity through healthy housing. And we achieve that through our mission, through which we're dedicated to addressing the social determinants of health and the advancement of racial and health equity through the creation of healthy, safe, and energy efficient homes. And we basically work hard to deliver a standard of excellence in all of our work to eradicate the negative health impacts of unhealthy housing, unjust policies for children, seniors, and families, and to ensure better health, economic, and social outcomes for low-income communities of color. So just a little bit about our background, and we can share a little bit about the work that we're doing actually a little more about our background. We do quite a bit of work around these HUD proposals and HUD grants, and have worked with multiple cities and towns to advise them on their grant programs, and have worked in more than 50 jurisdictions to help localities secure these proposals. We ourselves have successfully managed six. This is a little bit of alphabet soup for those of you who might be new to this. Office of Lead Hazard Control and Healthy Housing, Lead and Healthy Homes grant programs. We're actually spooling up a brand new one here in Providence, Rhode Island, where I'm based as we speak. We've conducted two HUD technical healthy homes technical studies as well, to help advance and build the field. And we assist jurisdictions in integrating lead hazard reduction and healthy homes interventions with weatherization and housing rehab solutions across the country. And we're doing more and more of that work as we see new resources coming down through the federal government, and I suspect that will grow over the coming years. And we're doing some exciting work in New Jersey there as well. You can advance the slide, Catherine. So a little bit about what we're doing in New Jersey. We serve as a technical assistance provider to the New Jersey Department of Health, and are eager to work more with local health departments across the state to help support lead poisoning and prevention initiatives. And you'll be hearing more about that as we move into the new year here. We are excited to be partners as part of the state, as part of the Lead Free New Jersey Coalition, and we co-chair the housing policy table. There's actually a meeting right now on the water side of the shop that we are participating in, as well as some other staff. We are really excited about a partnership that we have that we've been advancing with the New Jersey Board of Public Utilities and Comfort Partners, ISLES, and others, where we're implementing a whole house pilot program in the city of Trenton to basically integrate healthy housing and lead hazard control or reduction resources into units that have been deferred from the weatherization program, to get them back into weatherization and make them healthier and safer for households. And related to that work, we are also on the ground in Trenton implementing a $1.6 million DCA lead grant to remediate hazards in 50 or abate hazards in 55 homes in Trenton. So we are very active and very, very busy in the state of New Jersey. So what we'll do in terms of our agenda today is Catherine is going to be walking us through this grant opportunity, and we'll walk through available funding, eligibility and match requirements, which always warrant some thoughtfulness as folks think to proceed. Share guidance on rating factors. The wonderful thing about these federal proposals is the federal government sort of gives you the answers to the test, if you will, when they share how they're going to grade your proposals. And so it's important to understand how that works. And we'll share some just other considerations and TA tools, and then leave a little bit of time for questions and answers. And so that's essentially our agenda for the day. And I'm sure that most of you are familiar with these numbers, but just wanted to share a little bit of data around why this opportunity is important. We've seen some significant change over the past 9 years in terms of the number of children having an elevated blood lead level. You can see the numbers on the right-hand side there, dropping from 6,900, almost 7,000, to 3,000 children under the age of 6 with EBL elevated blood levels over the past 9 years, as I mentioned. But as all of you know, there's much more work to do. And you can see on the left there the locations where we've got the highest percentage of children under 6 with elevated blood lead levels as we continue our work in the state there. As I mentioned, it is an exciting time with the new law coming into force this summer in New Jersey to be thinking about this. And this is a wonderful grant opportunity to really intentionally build some capacity and advance some opportunities around a number of key sort of pieces of work that we'd like to advance in the state. And that's including building municipal capacity for lead inspections in the older housing stock, certainly enabling cross-agency coordination, which is a big issue there in New Jersey, with departments of health and municipalities and others working to implement the law. But that coordination around lead screening, environmental inspections, hazard reduction, and case management, with the focus in this grant around sort of the hazard reduction side of that. But as you all know, all of those elements are critical to have in place. This is an opportunity to certainly do some work on those, on better coordinating those resources. And then building new partnerships for compliance, lead poisoning prevention, and hazard reduction, and, developing contractor pools and whatnot as well. So it's a really wonderful opportunity to get these systems and partnerships established before you move into full implementation and production. So with that, I will let Catherine sort of take over and describe the specific opportunity, and thank you all for joining. And just one more a quick reminder, if you haven't done so already or you've just joined, please add your contact information into the chat so we can know who's on the call and follow up if needed. Thank you.
Great. Thanks so much, Bert. And I'll say, as we're getting going and getting into the details of the grant opportunity, if you'll help me keep an eye on the chat, I'll make sure that I can address questions as we go. We're assuming that most of you who are joining today have not prepared a HUD, lead hazard reduction, or capacity building grant before for submission. So we want to make sure that everything is as clear as it possibly can be for new grantees, because they are highly encouraged to apply for this funding opportunity. So as we go through things, we'll try to be as clear in explanations as possible, but ask that everyone, let us know if something is unclear, if we can elaborate on anything in particular. But as we get going, we'll start with the overview, and then we'll go into specific sections of the notice of funding opportunity. You can access that announcement from HUD through grants.gov if you haven't already, and download the full grant packet with the actual notice of funding opportunity, the NOFO, and appendix items that give a little bit more explanation on some of the things that they discuss, which I'll highlight as we go. But you'll see the information there with the grant overview. So, and one thing to note, the original submission deadline for this grant was January 4th. It has been updated recently to January 17th. So hopefully you won't have to work over the New Year's holiday to get it submitted, I'm sure is some of the thinking there. But that gives a little bit more time for preparation, thankfully. So there's a total funding allocation for this particular NOFO of about $33 million. The maximum of an award is $2.5 million and a minimum is $500,000. The funding period HUD estimates will begin March 1st for 2024 and go over a 3-year period. Eligible lead applicants are government entities, so that can be city, county, or township, local governments, a state government, special district governments, as well as Native American tribes, federally recognized, I should specify. Additionally, applicants are eligible if they have never previously received a HUD-led hazard reduction grant, or they have a demonstrated need to rebuild capacity. Yes, and we are recording today. I will say that this is a situation that if you're not sure if your municipality has received a HUD-led grant in the past, then several years went by and the program lapsed in some sort of way, it's likely that you are eligible to reapply for the capacity building grant if you need to complete the work that is described in this NOFO, but you may want to verify that by reaching out to HUD directly. And we've got the program officer's contact information. So you'll be able to, ask that question if you need to get that clarification. Also want to flag in this, subgrantees of previous grants are also eligible to apply directly. So say you are a subrecipient of a state government agency's HUD-led grant and you want to go out on your own, you're also eligible. We get a lot of questions about this, I will say, from nonprofit organizations or other agencies that want to do this work, but, say, well, I don't qualify for this. How can I participate? I will say that's this is a program that's designed to build partnerships with government and local agencies. So the government entity is required to be the lead in submitting the grant. But as you'll see, as we talk about the structure of the program and what's eligible for funding, there are a lot of opportunities for nonprofit partners that are, community-based organizations to be subgrantees for these. But the government agency does need to be the lead that's actually submitting the grant proposal. So just want to highlight a few things in the NOFO that I think will help, with writing. It's a lengthy document. It can be a little difficult to read. I know at times, especially if you're new to looking at these NOFOs. But early on in the NOFO itself, there's a list of grant program objectives that I think is provides a good sort of concise description of the purpose of the grant and also eligible uses of funds. So this section, I would say, is really helpful for thinking through kind of your key words on what to prepare and also helping you make decisions on what you want to actually fund and what you want to bring into your work plan. So when we say this is capacity building for lead hazard reduction, this gives you some detail on what exactly that means and what eligible uses of the funding will be. So, the sort of key things to keep in mind is that this is a sister program to the HUD Lead Hazard Reduction Grant Fund. So HUD has prepared this NOFO, keeping in mind that this would be, if you are selected, would be expected to, at the end of that 3-year period, either apply for HUD Lead Hazard Reduction Grant Funds so you're able to provide those services to qualifying households in your community, or in the case of New Jersey, that you would be implementing some other funding to have grant supported lead hazard reduction and healthy housing services. So capacity building involves helping to determine the prevalence of childhood lead poisoning and connecting cases of children with elevated blood lead levels into a pipeline for assessment and then hazard reduction. It also helps with capacity building for the workforce that's performing these different services. developing and implementing your internal policies and procedures for program administration and the partnerships with community-based organizations. Also obtaining high quality data to target resources where they're needed the most, and incorporating, the funding for lead hazard reduction with other resources that may be going into housing units. So those are, again, some keywords and concepts to think about as you're starting to prepare. So eligible uses of funds, we'll mention these numbers kind of throughout. In the full response that you'll prepare, you'll have 3 different sections, factors 1, 2, and 3. So 3 is going to be the description of your budget. So this will be critical information. So we'll repeat this a couple of times, but HUD, I think it's important to highlight, HUD differentiates some things here, where they have a cap on administrative costs, and what they consider to be administrative costs are reasonable costs for grant administration and oversight internally in your the applying government agency, as well as indirect costs, the necessary costs for general operation. So the total budget of what you prepare, of what you want to, what your grant request, that is capped at 10% for everybody. Additionally, HUD, for eligible costs, they have 2 categories. So one is direct program costs, which they have a list of in the NOFO of things that they consider to be directly related services for lead program capacity building. So those things are marketing, outreach, and education activities, building of partnerships and coalitions, the contractor pool development, and also developing a data sharing case management system. Then there are other allowable costs that are not considered direct program costs, but they are eligible. So as you're preparing and you're thinking about your total budget, HUD wants to see that cap at 10% for admin costs, and they want to see that at least 65% of the total budget goes to that list of what they consider to be direct lead hazard reduction capacity building services. So I know that can sound a little confusing, and if there are any clarifying questions, let me know. But I just want to make sure that you know that, and then when we go, we'll discuss that in the budget narrative portion a little later on, of kind of how you can describe that and make sure that you're verifying that in your total budget. These categories do become important. Also need to highlight that there is a 10% match requirement from the local government entity that's applying. And so HUD will ask you to describe that or note it in your budget, as well as a few other places, your budget narrative. They also ask for a match contribution table to be prepared that shows the source of this, and then a letter of commitment to confirm it. So the 10% match has to come from a non-federal source. And so we'll talk about some details of other potential sources of where that can come from. But I just want to reiterate here that can be, staff time. It can be direct program service costs for lead hazard reduction, capacity building, from other sources, but that'll be something that'll be critical to include in multiple places for the grant packet. Okay, so here's the description of the eligible sources of the match funds. First of all, the funding itself has to be allowable, an allowable use of funds for the lead match, are lead program costs. So that list that they have of direct lead costs that's in the NOFO, we want to make sure that the matching funds can go toward those things. It must be dedicated and integrated into supporting program activities. It can be in kind, cash, services, donations, or supplies. HUD also highlights if any of our participants today are administering other programs that are HUD funded. Just want to let you know that HUD does not consider community development block grant funds to be federal funds in this discussion, because they are an entitlement fund and the uses of those funds are managed locally. They consider that to be local funding. So often we work with housing program service providers and city governments who end up using 10% of their CDBG, who end up committing CDBG money as their 10% match for this. But you can also use other state, local, and philanthropic funds if that's an option for you. And again, there has to be a letter of commitment that confirms the total amount of that money is committed to the grant proposal. Yeah, and some specifics about what's required to be included in the letter of commitment, which we'll talk about with the full grant packet a little bit more, but you want to make sure that you're highlighting the specific dollar amount, how the funding will be used, and the source. So even if you're, a city agency, you're committing, you're the lead applicant, you're committing CDBG money from your community to be your match, you still will prepare a letter on your city letterhead to say we're committing to, and I have the authority to say we can commit to this amount of CDBG funding into the implementation of this program. All right, and then these are the required documents for the grant packet. This is everything, including supporting documentation that's mentioned in the NOFO. There's a chart that has a lot of these standard and required forms from HUD, kind of midway through the NOFO, but there's some additional things that are mentioned in the descriptions of the different rating factors. So this is everything. And again, we'll make these slides available to everyone who participated. I'm going to email them out to you as a PDF right after we're done. So don't feel like you have to write all this down. But we'll, and we can answer any questions that you may have as a follow-up to this. But they're the standard forms, the application for federal assistance, the recipient assurances and certifications forms. You may also need to share a applicant recipient disclosure update report, and you may need to declare some lobbying activities, applicant recipient disclosure report for lobbying. You are also required to use the HUD form to submit your detailed budget worksheet. So that's part of the grant packet that's available on grants.gov. But you can also do a Google search for that directly and pull the form if you need it. If you have trouble finding it, let us know. We can share a recent version with you. And then you will have some other sections to fill in on the SAMS.gov upload for the grant packet. One is your narrative response, which is a 15-page narrative, 12-point Times New Roman, double-spaced, that is specified in the NOFO, where you're going to respond to the rating factors 1, 2, and 3. So we'll get into the details of each of those over the next couple of slides. I also want to make sure that you know that each of those sections, you'll also prepare an appendix to go along with that, with required documentation that HUD asks for. For your factor 1, there's a request for you to upload resumes for your key staff members with a limit of up to 3 pages each for those resumes. And if you are planning to hire new positions for implementation of this grant funding, they will also want to see position descriptions for positions to be hired. For Appendix 2, that's your demonstration of need factor. So you'll want to make sure that you include your data sources, just like share or save the PDFs if you download data that you're using for that, and use it for reference, and you can refer to that as you're writing, that the references are in the appendix. But that's, we'll get into some more details there on Factor 2. Also, I want to make sure that this is clear for any agencies that maybe aren't familiar with this. HUD also will ask for, and they mentioned that they want to see a copy of the city or local government agencies lead-based paint element from their consolidated plan. It's required for any entitlement community, local or state, if they are receiving HUD funds for the Home Funds Program and Community Development Block Grant Program, that they prepare a HUD consolidated plan. That plan is required to have a lead-based paint element. So it is out there and almost always available to download from your city or county or state's website. So you want to make sure that you find that. And I typically download the whole thing, save the 1 page or 2 pages with the lead-based paint element, and then have that as a standalone available. You can also add the hyperlink, but sometimes hyperlinks don't work. So, just throwing that out there. It's required. It's only mentioned once or twice. It's a little bit obscure in the NOFO, so I don't want to let people miss that. And then Appendix 3 are going to be your budget items. You're going to upload a separate budget narrative that does not go to your 15-page total limit. You'll have this standalone match table that'll be a separate upload, as well as your letters of commitment. All right, so we'll get into Factor 1. So they're broken down as Factor 2 worth a total of 40 points, Factor 1 of 40 points, Factor 2 40 points, and then Factor 3 20 points. So as you're writing, know that those are kind of those point allocations kind of give you ideas of like points of emphasis for HUD and where you want to spend the most of your narrative sections and time probably in preparation. So Factor 1 is broken down into 4 sections: program administration and oversight, and community outreach and marketing are the first 2. So for these sections, you want to make sure that you're hitting these key things that they have included in the NOFO. As Bert mentioned, it's usually pretty straightforward of like what HUD is asking for is what they want to see in these responses. But want to make sure that it's clear that there is a requirement with this funding for in your staffing plan to have a project director that is identified in your staffing plan, and that you have a program manager that is identified or to be hired. And in particular, that program manager has to have at least 75% of their full time committed to implementation of the capacity building grant. They also want to see in that first section a financial management plan, and in particular, like who has oversight of federal funds in your office and who is going to make sure that there's a good fiscal management plan that you'll describe in a little more detail in Factor 3, but you've got staff that has experience and capacity to do this work. They also want to make sure that you're envisioning what the first 90 days of your startup period will look like, and that within 90 days you're going to be fully executing your work plan and have your staff in place and ready to go on your activities. The community outreach and marketing, you want to make sure that you're highlighting your kind of key implementation partners. So we'll talk about some options there. Any plans to coordinate with external agencies outside of your office to complete activities. So that can be, different housing agencies, healthcare partners, early childhood education partners, whoever's could be supporting your workforce development and training. So those are, like make sure that you're mentioning those key agencies, and that's section B. And then the last 2 in Factor 1, we'll want to see, HUD wants to see a description of the contractor capacity and public-private partnerships. So if you're planning on doing some workforce training as one of your key activities, HUD will likely, want you to describe the training resources that will be available, your training plan, and how many contractors you're hoping to engage, what sort of services that you expect them to provide, whether they're going to be lead renovation, repair, painting workers, lead risk assessor, inspectors, that you're trying to build capacity of your lead abatement firms, so as detailed as you can be on that, the better, and how you will engage community-based organizations to do that recruitment, what other considerations you're taking into that work planning in your outreach and engagement for contractor capacity, and how that's going to help you, get within this 3-year period, get into a position where you can administer a lead hazard reduction grant program. Also, if any of these partners have previous experience in relevant environmental health or housing programs. This is just, again, providing some detail for some of that existing capacity. And then the last section is similar with relevant organizational experience for the lead agency on the application. Make sure that you're describing your recent experience in managing lead hazard control projects, if that's been a part of your work, but also any experience that you have administering any federal grants, especially those that have been committed to any sort of housing rehab, repair, inspection programs. That'll be something that'll be relevant to show that you've got some previous experience in these fields, even if you're, haven't worked with the HUD Office of Lead Hazard Control or Healthy Homes before. All right, I'll just pause. Do we have any questions on factor one? Oh, Bert, are you speaking? I'm sorry.
I said it seems we're okay.
Okay, good. Next section, factor two, is everyone's favorite, data. We get a lot of questions about the data sources and allowable uses. My best advice really is read this section thoroughly. We'll provide some suggestions for where you can get this data if you haven't accessed it before. For these particular data points that HUD is requesting. But again, just do what you can to provide what they're asking for, and then make sure that you've got your references in factor two, and that'll make it easier for the reviewers to give you the maximum amount of points allowable here, because you can actually leave a ton of points on the table in this section if you don't at least make an effort to provide the data that HUD's looking for. But I will say it's pretty straightforward. We've worked on these grants for many years, and I often highlight that the data that HUD asks for is not available for every municipality in America, and they've really put in a lot of effort to streamline this to make sure that it's accessible. What they're asking for is accessible everywhere. So thankful for that. Shout out to HUD. So what you'll want to prepare, though, we just want to make sure that this is clear in factor two, is that you are going to copy and paste this exact table and submit this table to HUD. They are asking for these particular data points that are in the left-hand column. They also ask for comparison data for those. So, looking at the first example, you'll look for your housing data at data.census.gov, and you'll find the number of pre-4019 housing units. For your target area, you'll put that there. Then you will put in the total number of housing units for your the total target area of any age, and then you'll do a calculation there to show a percentage, which will be your justification of need. So if you're, I always do this in sort of a data-driven storytelling mode. What HUD is looking for is they want to see the number of total pre-1940 units that you have, and then also the percentage of your housing stock that is pre-1940, and that will give them an idea of how severe of a lead hazard issue you're having in your community. And same thing with pre-1978. They're also asking for the number of housing choice vouchers, HUD housing choice vouchers that are available in your community and being administered, the number of children under 6 years of age, and then the number of people in the target area that are at 80% area median income or less, or 50% area median income or less, because those are the numbers that HUD looks for with eligibility for their programs. So after you do that table, you're asked, and this is actually, I think a pretty significant point potential for this NOFO. Up to 20 points, you'll have a couple of probably 2 to 3 paragraphs to fill in to have a narrative description for your statement of need. So that will give you an opportunity to tell a little bit of a story about your community and why you need this capacity building grant and what you hope to achieve with that funding. So HUD has given you some suggestions of what to look for here. So they have a list in the NOFO and ask that you will address at least 5 key capacity building needs from the list that they provide. So, our recommendation really is to take a look at this list, think about, how there's a need for this grant in your community, what is achievable with the funding that you're asking for and how you're applying it. But some of the metrics that you can look for to help to drive this description of your community would be looking at what are your, blood lead screening rates? How many confirmed cases of elevated blood lead levels do you have? What are the family and children needs in your community to address and prevent lead poisoning prevention and respond to cases where we know children are being lead poisoned? You also can take a look at the number of qualified contractors to complete lead hazard reduction work in your community. If there's a real need for contractor recruitment and training, you'll be able to find some data points around that to say, look, we know we only have 4 lead abatement firms that are in our jurisdiction. We want to double that to be able to produce units in the future. Those are the kind of ways to kind of weave in those metrics into the description that you're writing. Marketing outreach of community partners, you can think about maybe like you have a federally qualified health center that has an early childcare initiative. They have a reach of X patients a year that they're seeing in a pediatric clinic. That can be a story to tell about the potential of doing more work with community-based partners to expand awareness of lead issues and connect them to services. And also, of course, your housing repair program data. If you have any experience with any rehab programs that are funded, through your CDBG funding, home funds, also, your nonprofit partners, Rebuilding Together, Habitat for Humanity. We can talk about some of those things as well if you've got that data available. So we have a list here of the kind of key sources of data based on what HUD is asking for that you can look for if you need any help finding your jurisdiction's data. You can absolutely reach out to us. But most of these data points are going to be available from either existing databases online that you can search and pull data for your communities, like data.census.gov, as well as the HUD consolidated planning data to get your median income data that they ask for and that's required. But there's also some state offices that you'll likely need to reach out to get information. Of course, the Department of Health has their lead poisoning surveillance data available online in their reports. But for the housing choice vouchers, you may need to reach out to your local housing authorities, public housing authorities to find that. There's contact information online that will help you on that search. So if you have questions or concerns about how to get any of this information, as well as information on your inspectors and risk assessors from DCA, we can definitely provide some support there. So these are hyperlinks. You'll be able to find this stuff pretty easily, but if something's confusing, let us know. All right, and the last factor in the narrative response is 20 points for your budget proposal. So this is actually, you'll see this, and I think HUD has clarified this multiple places where I think it's been a little confusing in years past, is that you will actually upload your detailed budget worksheet and your budget justification narrative as a separate attachment. So that's not a part of, again, your 15-page total cap. And they have an example of the budget justification narrative in the appendix. I forget which one it is, but you can see exactly what they're looking for, and we'll walk through that and answer any questions anyone may have. So the first 2 things that are noted in the Factor 3 section of what to prepare are actually, included as separate. But in the Factor 3 for your 15-page narrative, there is a section to add in a description of your fiscal oversight and management, really, how you're going to be tracking the use of the grant funds, who's going to be in charge of that, what's your internal process, what in your policies and procedures for fiscal oversight, and then how you will be administering reimbursement requests to HUD. So it's pretty straightforward in terms of what they ask for, but just keep in mind that that'll sort of flow with part of what you described in factor one with your program administration and oversight. It may even be a little repetitive, and that's okay, but you want to make sure that you have a good detail of how you're managing your finances in your office. And then the last section for factor three also includes a point of emphasis for HUD, is a description of your section three strategy. So section three is a program that requires grantees to the greatest extent possible to provide training, employment, and contracting opportunities to low and very low income individuals. So that is an opportunity just for you to highlight if you're doing outreach, workforce capacity building, if you're, hiring contractors, you're working with community-based partners. If you know any of the individuals providing services or receiving trainings in your programs are coming from neighborhoods that would be served by HUD programs and are coming from areas that have low and very low median incomes, you can provide a description of that to maximize those points. So yeah, I mean, I've already said this at the top. I'll just, say again, in your budget narrative, HUD is looking for certain things, and they want to make sure that you've got descriptions of your of each line item that's in your budget, and describe, like how you're calculating your fringe and personnel, how what other like direct services are you including, if you're purchasing supplies, how you're coming up with all those calculations. But additionally, they want to have a description of the breakdowns of your 10% administrative costs, 10% of matching funds, and that the 65% of the direct lead costs is as a percentage of your total budget is clear to them. So if you have any questions about that, we'll just leave that to the end. But that's a key part of the budget narrative that's a little bit different, or unique to, I would say, some HUD NOFOs that we've looked at in the past. And I think that's really, those are the main kind of points. I think there's a couple other things here, but want to make sure that we emphasize this, that trying to make, as you're preparing your grant packet, that you're keeping your numbers consistent in the way that you're describing things. So from your budget to your letters of commitment to the budget narrative, that all of because you're asked to repeat things 3 and 4 times sometimes with the things that HUD's asking for, but we want to make sure that each time you're using the same figures for things that are attached to your budget. So there are some bonus points also available, up to 2 if you're working in a Promise Zone area. So that's something that you can look on the Promise Zone website and see if like a Promise Zone community is part of your target area. And there's a form to fill out to verify that is the case. There's also a bonus of up to 2 points for inclusion of minority serving institutions in your work plan. So if you're planning on working with a subgrantee or key partner that is, oh, and I see a typo, that a historically Black college and university, HBCU, a Hispanic serving institution, tribally controlled institution, Native American, predominantly Black institution, Asian and Pacific Islander serving, those are the communities highlighted. So it's not, in previous years, HUD has had a focus primarily on supporting partnerships with HBCUs. This is just a little bit more of an expansive definition of minority serving institutions and their inclusion in your work plan. But that'll get you 2 extra points. So again, there's just some kind of general grant prep information to close this out before we have time for Q&A. That, this is due the 17th. It's a required electronic upload. So you want to make sure that you're registered in the SAMS system, that you have a unique entity identifier number that's required for you to upload for your municipality or local government agency, that and you're consistent about your target area. Of course, as we're describing this, we may have some questions along these lines. a municipality can apply alone. They can apply, with a partnering municipality. There could be a city and county government partnership. All of that is eligible in terms of your grant application structure and what you're going for, but there still needs to be a lead government agency that's going to be the one submitting, and then you want to make sure that you clarify which jurisdictions are targeted for program services. So those kind of cooperative agreements are absolutely fine to manage and to use for the structure of your work plan, but you just want to make sure that there's a clear differentiation of who the lead is and who the supporting agencies are. So yeah, here's just some other recommendations that we can make. We want to make sure that it's clear that this is a resource, and HUD is really committing a lot of funds. Having up to $2.5 million over 3 years to complete these activities is a really generous resource for a lot of communities and can help with your staffing and contractor training. So as you're thinking about your design, this can really be customized to the things that you need in your community, which is a wonderful potential resource to have. But also, just be aware that this is a competitive grant process. So as you're starting to write and pull this together, you want to maximize your points to the greatest extent possible. So and try to get the bonus points if possible. So try not to leave any points on the table and leave sections blank. That you answer all of HUD's questions and use those NOFO prompts to outline your narrative response, and again, set up and use that checklist that we have prepared for all the things that are required to submit. Being consistent with those funding numbers. Have someone that you have in your grant writing team that's going to do a consistency check, that's their responsibility, and they are a good detailed oriented person. That can be very helpful, just to give that one person that job and making sure everything matches up, from your budget to your narrative to all of your appendix items. And we're, have a lot of, we say the letters of commitment thing a lot because we see errors with that sometimes. So if you have any questions about that, let me know. So I'll also share that since HUD has changed the submission deadline for this to the 17th, they've also announced that they're going to be hosting another webinar where they can provide direct Q&A. So you're encouraged to contact them if you have any clarifying questions, but we would also, just highlight if you want to ask the Victoria Jackson from the Office of Lead Hazard Control and Healthy Homes and her staff any questions to clarify any of these eligibility questions, or if something is unclear in the NOFO. I would highly recommend that you register to attend that webinar next week, and you can share that question with them and they'll respond to it. They also will produce an FAQ that captures all of those questions. So as they get those from other agencies, they share them out. So it's a great benefit to just keep track of what they have for, providing clarity on anything that's maybe unclear in the NOFO itself. So we'll pause there. We have a good amount of time left for questions. So if we want to revisit any slides, or if you have any questions for us on kind of preparation strategy, Bert and I are available.
Not seeing any questions come through. Might have one for folks on the group, but are folks considering pursuing this? Yeah, that's great. Okay. At least a couple of folks. It looks like it really does. It's a great opportunity to be intentional about capacity building, and would love to see folks go after it and get these systems in place, with a fair amount of intentionality before you move into full-blown unit production. It's nice to be thoughtful and not under deadlines associated with, grant production benchmarks. And so it's a really wonderful opportunity. And I think with the new rental law coming into place, that you have some fantastic context around which to sort of frame your proposals moving forward. So again, just would really encourage folks to think about this.
Yeah, and I think one of the things that's really exciting, the potential of having this grant resource for New Jersey municipalities related to the new law, is that we're seeing a lot of communities wanting to improve the direct partnership and data management across health departments, the housing office at the city, as well as the inspection entity, whatever, whichever office that may be in a city government. And this is a grant that will help support building that backbone, which I think is just going to be so critical moving forward to help streamline inspection information and data, what's captured, as well as case management when it's needed, if there are children that are in units that have any hits on the dust wipes, and other inspection practices. There will be a system in place so municipal agencies can quickly respond to those situations, which is what we want, to be able to help support families getting children out of unhealthy and toxic environments.
Yeah, and so to the sense that folks have been mandated to sort of work together and implement this law, this is actually a funding source that would support you to build your collaborative, as Catherine pointed out. Hey, Catherine, I see there is a question here around, do I have access to this recording and slides? I know the slides we'll share.
Yeah, the slides that we will share immediately. I think we are able to upload a recording. So we'll share out a link once we're able to do that. I think we were able to do that through the GHHI website. I'll verify and share that with everyone. But yeah, as soon as we close out, I'll share the PDF of the slides so everyone can access that. Yeah, and I see that. So the project period is a 36-month period, and HUD is estimating that that will begin March of 2024.
Catherine, I had a question. Are they expecting any of these, or can these resources be used to complete units, to actually get units done?
So this grant funding itself is everything but lead risk assessments and lead hazard reduction. So it's really meant to fund that startup. But there is, I will say, and clarify this, there's an expectation, and this is described in the NOFO, that if the agencies applying for grant funds, if they are awarded the capacity building grants, that they are expected to be doing lead hazard reduction work within 6 months of the end of the grant period. So again, that could be your plan for this could be, we're going to apply for capacity building. If we get awarded, we'll do our work for 3 years to get up and running. And then we're going to apply for a HUD lead hazard reduction grant fund to do that work. That could be your pipeline for how you're building programs. You could also get to the end of that 3-year work period for capacity building and say, we're going to administer this through DCA funds that we have for our community. That's also possible. But, again, HUD is looking for, this is a good kind of guiding strategy in your writing process to say, okay, if we do all of this, these are the efforts. The outcomes of this will be, we'll be prepared to do lead risk assessments and also complete lead hazard reduction, healthy homes, intervention services in low and moderate income housing in our communities. And that could be specific to renter, or it can be homeowner and renter. You can sort of think about the structure of what that would look like at the end of this process. But that's the goal of the Office of Lead Hazard Control and Healthy Homes.
We got a question here about whether or not funding will be available next year if folks aren't ready to apply for this particular round.
I think yes. It's highly likely. I will say HUD, the Office of Lead Hazard Control and Healthy Homes, will announce NOFOs throughout kind of the calendar year, and they just added capacity building back to their annual funding plan, I think maybe 1 or 2 years ago. So we anticipate that this will be around. Um, the and so, it's likely that we'll see another opportunity in 2024 for this particular grant. But I will also say that this office will also be announcing another round of the HUD lead hazard reduction grant funds. Many of the things that are eligible for funding in the capacity building grant are also eligible uses of funds for the lead hazard reduction grant program. The difference, as Bert and I were just saying, is that you will also be required to do lead risk assessments and lead hazard reduction services and commit to a certain number of units that you would work in within it. For new grantees, I think it's a 4-year period. So they build in a little more capacity building at the front end of that. So that's an option, and that's a much larger funding allocation available to that program. So I will say it's a little bit less competitive. So if you haven't applied for any of these grants before, there are those two things to think about specifically for lead. But this office also releases notices of funding for standalone healthy homes production grants. They have older adult home modification grants, and a couple other things that they release throughout the year. So GHHI, we keep track of that. We'll share that with our this network of folks, as we get them, and make sure that everyone knows what the eligible uses of funds are there. So yeah, I just to say all that, there are opportunities coming out that we'll be keeping track of and that we'll share with you. So if now is not good timing for you, you can anticipate in 2024 there will be multiple opportunities to kind of get the ball rolling with this.
Great. Are there any other questions? Seems we might be able to give you 4 minutes of your day back.
Well, really thankful for
Wonderful.
everyone who was able to join, and hope that this was helpful. And, we'll have my email address to follow up if you have any additional questions that you think of after the fact.
Wonderful. Thank you all for joining, and we'll look forward to a hearing of some successful proposals, hopefully. Thank you all.
Thank you. Bye-bye.